I'm Dr. Helen Bernie, and I'm a board-certified fellowship-trained urologist and the director of male sexual and reproductive medicine at Indiana University. Erectile dysfunction is extremely common. In fact, 40% of men in their 40s have erectile dysfunction, 50% of men in their 50s, 60% of men in their 60s, and you see there's a pattern here. Many things can cause erectile dysfunction. If you think of it, whatever's healthy for your heart is healthy for your penis. So poorly controlled high blood pressure, high cholesterol, diabetes, tobacco smoking, poor sleep, poor diet, poor exercise, all of these things can lead to erectile dysfunction because what can injure our blood vessels in our heart can injure the vessels in our penis much sooner. So typically our first line of treatment is two things. One, lifestyle, behavioral, diet modifications. So if you have conditions like diabetes or high blood pressure, it's best to get those under control, go see a primary care doctor, and get those conditions better regulated or hopefully preventable. Next, first line treatment options are typically pills. Pills consist of Viagra or Cialis, like you hear the little blue pill, or any of the generic forms of pills. Pills work great because what they do is they vasodilate, so they increase blood flow into the penis to help a man maintain or achieve an erection sufficient for penetration. So typically, most of the time, we start with pills first. And the reason for that is that they're just oral pills, they're minimally invasive. When pills no longer work, however, which can occur, we typically look at three other options, and that can range from penile injections, a vacuum erection device, or a penile implant. Penile injections are where we bring a man into the office and we teach them how to inject using a very small needle, a medication into the side of the penis. It typically works in about 10 to 15 minutes after injecting and gives a man a natural erection. The next option is what's called a vacuum erection device. A vacuum erection device is a hollow tube that you place over the penis, and using a hand or battery operated pump, it creates a suction, drawing blood into the penis. You then place a constriction band down on the base of the penis to trap that blood into the penis. The constriction band can be worn for 30 minutes and then it needs to be taken off. But both of those are good options to help a man achieve an erection. If pills no longer work, and either of the two other options I mentioned, penile injections or vacuum erection device, are not desired or have failed, the next option is what's called a penile implant. A penile implant is a same-day outpatient surgery. It takes about 45 minutes where we place two cylinders in the penis, a pump in the scrotum, and a reservoir that contains saline or salt water. It helps a man have a natural, spontaneous erection on demand by inflating a completely concealable pump that's hidden in the scrotum. This is done many times in the United States and is typically considered the gold standard for erectile dysfunction. So it's a really good question. So I think it really depends on the goals of the couple and how well his erectile function is at baseline. If someone is responding to pills and they're not bothered by side effects which can occur such as headache, facial flushing, and they don't mind having to take a medication at least an hour prior to sexual activity, pills are a wonderful tool in the armamentarium for patients to use for sexual intimacy. Sometimes people have really bad side effects from taking the pills, such as I mentioned, the headache or facial flushing. Other times, patients, due to spontaneity in their sexual intimacy, they don't want to have to take injections, and they don't want to have to inject themselves or wait for medication to work. In those cases, having a penile implant can be a really wonderful resource because the penile implant, outside of the same day operation to place the implant, once someone is healed, it's available and it's spontaneous and it can be inflated within 30 seconds to a minute. And it allows someone to have sexual intimacy as long as they want until they push a button on that pump to make the erection go down. So I think a lot of times it's really the goals of the patient and where their erectile function is. Someone may no longer respond to pills or may no longer respond to injections or vacuum erection device, and in those cases, the next best step is a penile implant. I think incorporating healthy diet and lifestyle habits is paramount, regardless of erectile function, regardless of what medications you're using. If someone doesn't take good care of their blood pressure, if someone's not taking good care of their diabetes, then pills will no longer work. Injections will no longer work, and eventually the only option will be a surgery. However, if we're unhealthy, we might not be healthy enough to undergo surgery. So again, diet, lifestyle, exercise, all of those things are paramount and primary so that you can enjoy a long, healthy lifestyle. Someone should come see a urologist at the first sign of having problems with erectile dysfunction. because erectile dysfunction could be related to low testosterone levels, it could be related to lifestyle, behavioral factors, or it could be related to poor blood flow to the penis. A urologist is going to help you determine what those issues are, what's causing it, and the best treatments moving forward. Penile implant is a great option for many men to be able to regain control over their sexual intimacy and their erections. So a penile implant is a same-day surgery. It takes about 45 minutes to 1 hour, and you go home the same day. What this surgery entails is we make a small incision either above the penis or on the scrotum, where we place 2 cylinders that are going to go in the penis, a pump that's in the scrotum, and a reservoir that fills with salt water or saline that's going to inflate the implant. What it does is it gives a man a natural, rock-hard, rigid erection that lasts as long as he wants until he pushes a button on that pump to deflate it. The penile implant is completely concealable, so you can't see it and no one will know that you have one. A penile implant has a very high satisfaction rate. It comes with a 98% patient satisfaction rate and a 97% partner satisfaction rate. Anytime you put an implant in someone's body, whether it's a knee replacement, hip replacement, or a penile implant, there's always a risk of an infection. Risk of an infection in their first implant is about 1 to 2%. So the risk is very low, but there is a risk. The implant also comes with a lifetime warranty. However, about 15% of the devices stop working in the first 20 years. The penile implant is a great option to give a man a functionally straight erection for penetrative intercourse. I always have guys come ask me and they say, can you make my penis bigger? And I always kid and I say, if we could do that, we'd be billionaires living on islands, we wouldn't be urologists. But the truth is, what we do is we maximally stretch the length that you have. And then through a process called cycling, which we train you how to do after you've healed after your surgery, where you're going to maximally inflate and deflate the device daily after your implant, it can get back 1 to 2 centimeters of length loss. But a penile implant is not going to change someone's anatomy. It's going to optimize what you have, prevent further length loss or penile fibrosis and shortening, and it's going to give you the ability to have a natural, spontaneous erection anytime you want. So a penile implant is typically covered by many insurance companies. It's also covered by Medicare. In patients where they don't have insurance or they're not able to afford a penile implant, we do have cash pay options as well. So speak with your urologist about those options. So I think it's so important to understand that erectile dysfunction is very, very common, and it can be oftentimes caused by medical conditions that you can help prevent and treat. So please go see a urologist, talk to a urologist about your health care if you're having any problems with erectile dysfunction, because we have many, many different treatment options that can work for you and your partner to enjoy a healthy sexual life.